We're also working the latest developments in the tragic death of a Rhode Island child. As we first reported yesterday, a 10-year-old girl from Cumberland who died of an infection also tested positive for the respiratory illness enterovirus D68. And now we're learning more about what's being done to keep other students safe and what local families need to know about the illness. Eyewitness News reporter Susan Campbell joins us now live from the Department of Health with the Providence Mobile Newsroom.
Today I spoke with Cumberland superintendent. He tells me there hasn't been a spike in absences, but he says the school district is taking precautions to help keep kids healthy. Doorknobs and desks and all of the other surfaces at Cumberland schools are being cleaned every day. The district superintendent tells Eyewitness News school buses are also being disinfected more frequently, and students are being encouraged to wash their hands often. This all in response to a little girl's death last week. A fifth grader at community school in Cumberland tested positive for enterovirus D68, but the Department of Health says she died of Staphylococcus aureus sepsis. Though we will never know what role, if any, enterovirus played in her death, we do know parents have a lot of questions and concerns about the sickness. That's why we went to a pediatrician today for answers.
It's impossible to tell the difference.
Dr. Peter Yasijan tells us in most children, enterovirus D68 will look like the common cold.
I don't think they need to panic with every runny nose or every cough. But they need to be keeping a closer eye. If they look like they're progressing beyond the sniffly nose and the regular cough, if they look like they're having any breathing problems, they need to take it seriously. Anytime the child is showing any distress, don't wait till the next morning. Don't take it lightly. Do contact your doctor.
According to the Rhode Island Department of Health, the 10-year-old who died had no underlying health problems. And of course, we've said it before, but it's certainly worth repeating. To avoid illness, you should wash your hands often. You also should avoid touching your face. And if your children are sick, make sure you keep them home from school. Coming up new at 6, we're checking in with Cumberland's Director of Emergency Management. For now, live with the Providence Mobile Newsroom, Susan Campbell, Eyewitness News.
Count on Eyewitness News for continuing coverage of enterovirus D68, both on air and online. We've posted valuable resources on WPRI.com to help you learn more about the illness and keep your family safe, including information about prevention, symptoms, and treatment of enterovirus D68.